Hello everyone, this is Dr. Rufus Vasanth, Senior Consultant Orthopedic Surgeon, specialized in arthroscopy, trauma, joint replacement and sports medicine. Today we are going to discuss about another important topic, it's elbow pain. Lot of patients come with elbow pain. Not all elbow pains have similar diagnosis, they have different diagnoses for different conditions. So three common conditions which I am going to discuss first are tennis elbow, golfer's elbow and triceps tendinitis. So what do you understand when I say tennis elbow? Does it happen to players who play only tennis? No. Initially, people who are playing tennis were diagnosed with a condition called as tennis elbow. So basically in your forearm, you've got muscles on the two sides. One is called as the flexor compartment, the other one is called as the extensor compartment. So the extensor compartment muscles, they attach to a common point called as lateral epicondylitis, that is the outer side of your elbow. So outer side of the elbow, when somebody complains of pain, the first diagnosis is always a tennis elbow. So what does a tennis elbow mean? See, the outer side of your elbow has got a specific bone called as lateral epicondyle. In lateral epicondyle, you have few muscles getting attached, out of which the commonly affected muscle is called as extensor carpi radialis brevis. In addition to the extensor carpi radialis brevis, you can also have other muscles like extensor carpi radialis longus and extensor carpi other muscles. So all these muscles can get injured. So basically when it gets attached to a common point, it gets pulled. So basically it's like something getting torn. In such conditions, it's called as tennis elbow. What is a golfer's elbow? Golfer's elbow is exactly opposite of tennis elbow. This happens on the inner side of your elbow. So inner side of the elbow, you also have other kind of muscles which get attached to a bone called as medial epicondyle. So when you get medial epicondyle, the place where all the muscles get attached, it's called as medial epicondylitis or golfer's elbow. Initially, it was found for people who are playing golf, so it is called as a golfer's elbow. So both these conditions can happen to anyone. I see a lot of patients from IT professionals coming with these kind of pains. Elbow pains around the elbow, it can be on the inner side or on the outer side, or it can be on both the sides. So when they complain of pain, the first thing which runs in my mind is whether it's a tennis elbow or a golfer's elbow. I obviously examine the patient, I do certain physical examination tests. I come to a conclusion that it can be this problem. And then we do something which is called as an X-ray. In X-ray, what do we look? Most of the times, X-rays look completely normal. But sometimes there can be some extra bone formation called as calcifications, or sometimes there can be an extra problem called as tendinitis, or it can be extra problem called as fractures. Some small chip fractures can also be seen on an X-ray. If the X-ray is normal, like any other problem, I would always start them with physiotherapy and tablets. What kind of tablets? Some anti-inflammatory medications along with physiotherapy like ultrasound therapy or laser therapy. Most of the patients feel a complete relief by 10 days. In addition, do I do anything? Yes, I give a tennis elbow brace or a golfer's elbow brace. So this brace is not applied on the part of the pain, it is applied a little bit lower, below your elbow. So the concept is that it stops your muscles at that position. So at that point, after that the muscles get rest. So these are the things which we normally give. 99.9% of patients feel very comfortable and by 10 days they say that my pain is completely gone. But some patients say, no doctor, my pain is still persistent. In such situations, I will do a little bit more investigation, like I will do an MRI scan to rule out any other problems inside the elbow joint. If everything is normal, I would suggest them few injection therapies. As I say, for all conditions, the first thing is always a steroid. A lot of senior doctors and for a very long time, steroids have been a local injection given for many patients. Steroid, the advantage is that the moment you give it, the pain comes down. The disadvantage is that it doesn't cure the disease and has got no idea how long it will work. Some patients say that it worked for 6 months to 1 year. Some patients say that it worked only for that night. So steroids are very suspicious drugs. Misuse of steroids is not acceptable. If you give one shot of steroid injection, the next injection should not be given for the next 6 months. The other injections are stem cell therapy. We have a lot of stem cell therapies like PRP, platelet-rich plasma, ACS, autologous conditioned serum. Then we have tissues generated like adipose tissue derived cells from your abdominal fat. We have bone marrow aspirate concentrate from your hip bone. All these things do work well. The concept is very simple. Something is torn from the bone, so we want it to heal. When you give natural therapies like these stem cell therapies, they allow it to heal. When we give steroids, they don't allow it to heal, but they allow to reduce the inflammation and reduce the pain. So steroids are for immediate action, but stem cell therapies take a little bit longer time. They gradually work and make you feel better. Both should not be combined. Generally, stem cell therapies are not combined with steroids or with any local anesthesia. They are very safe to give directly. Very rarely, when all these conditions are treated with all these kind of modalities like physiotherapy, medications, brace, injections, and if still the patient complains that no doctor, I still have a pain. This has been there for many years with me. In such situations, we do a arthroscopic surgery. So arthroscopic surgery is basically keyhole surgery. Laparoscopy is something which is done in your abdomen. When we do in the joints or around the joints, it's called as an arthroscopy. Few small holes with the help of water flow, we treat whatever the problem is. Extensor carpi radialis brevis is one of the commonest tendons involved in tennis elbow condition. So it will be released and the patients have a beautiful pain relief immediately after surgery. In addition to these two conditions like tennis elbow, which is the lateral epicondylitis, and golfer's elbow, which is the medial epicondylitis, we can also have triceps tendinitis. So we all know what a triceps is. Triceps is a muscle which is behind your arm. So this muscle gets attached at such specific point. Sometimes it can tear. Sometimes it can start developing inflammation. The treatment initially will be again physiotherapy and medications. If you're not responding, go for injective therapies. Very rarely it ends up in a surgical intervention. There is another condition called as olecranon bursitis. Olecranon bursitis is again, olecranon is the sharp bone at the elbow, behind your elbow. So this bone sometimes because of constant friction, people who sit for long hours, people who use system for long hours, mouse for long hours, they keep on rubbing the olecranon and slowly it starts to get inflamed. You start getting a boggy swelling there. This olecranon bursitis usually is a headache because most of the times it requires a surgical intervention and many times it gets infected. When it gets infected, whatever antibiotics, other things you give, it is only for a temporary solution. So it might need a surgical intervention to completely release it. What are the other conditions around the elbow? So far we discussed only three things, that is the tennis elbow, golfer's elbow and the triceps tendinitis. All these are soft tissue problems. We can also have bony problems. For example, fractures. Fractures around the elbow are very, very common. Children many times have something called as a supracondylar fracture. It is very, very common in children who are younger in age. When they have a fall, the elbow fixes in a particular position and ends up in a fracture. Supracondylar fracture is basically the lower end of your arm bone called the humerus. So these fractures, undisplaced fractures are treated with POPs and plaster of Paris, but displaced fractures usually require surgical intervention with the help of small metal pins called as the K wires. So these are the fractures which are very common for children. In adults, any kind of fracture can happen. There can be something called as a radial head fracture. Radial head fracture, again, if it's an undisplaced fracture, we treat it conservatively. If it's a displaced fracture, we try to fix it. If it's completely shattered and cannot be fixed, then we do a radial head replacement. Similarly, the other bones around the elbow, like distal part of the humerus, that is the arm bone, the lower half of the arm bone, olecranon, anything can be broken, and all these things are generally fixed surgically because elbow is a very important joint. As I always say, joint fractures are more significant and more important because they are the moving parts of your body. The places where your joints or the bones don't move, they are not called as joints. The places where your bone moves is called as joint. In such situations, it's always better to treat it properly. The other common things which we see around the elbow is that there's something called as a ulnar nerve. Ulnar nerve is called as a funny bone because many times when somebody hits your elbow, suddenly you have a jerk, you feel something funny there. So that is called as a funny bone, it's the ulnar nerve. That ulnar nerve can sometimes get compressed. In such situations, patients have altered sensation in their hand, especially in their small finger and the finger next to it, that is the ring finger. So we call it as 1.5 fingers. So these 1.5 fingers can always have some kind of a tingling sensation, altered sensation or difficulty. In such situations, we diagnose it as an ulnar nerve praxia. We do nerve conduction studies, MRI of the elbows to find out where the nerve is compressed. Nerves are a little bit taken seriously, not like fractures, because fractures, it can sometimes unite, sometimes not unite, but we do a proper surgery, it 100% unites. But nerves are not like that. If you don't intervene at the right time, if you come very late, sometimes the results are very, very unpredictable. Ulnar nerve can be treated in multiple ways. Anterior transposition of ulnar nerve is one of the commonest things which we do for many patients who have ulnar nerve praxia. So these are the 5 important things which I have discussed so far. One is the tennis elbow called as the lateral epicondylitis, the golfer's elbow called as the medial epicondylitis, the triceps tendinitis which is the back of your elbow, olecranon bursitis which is again at the back of your elbow, fractures around the joint, and even the 6th condition which I have discussed is about the nerve compressions. It's called the cubital tunnel syndrome, and all those things can really cause a lot of discomfort for patients. Many times when patients also come with elbow pain, we should be a little bit careful that because elbow, the bones connect to the other joints also. For example, the radius and ulnar are the bones which connect one end to the elbow and the other end to the wrist. Similarly, humerus is a bone which connects one end to the elbow and other end to the shoulder. So sometimes shoulder pathologies can also have elbow pains. Sometimes nerve compression in the neck can also have elbow pains. So shoulder pains, what are the other conditions we look at the shoulder? Shoulder is a very beautiful joint. It's a very big joint. It's called as a ball and socket joint. So it rotates 360 degrees. It's got a lot of muscles and tendons inside the joint. So any muscle tears or tendon tears, sometimes the muscles attach from the shoulder to the elbow. For example, biceps. We all know biceps muscle. One end is attached to the shoulder. It's got two heads, long head and short head, both in the shoulder joint. The other one is in the elbow joint. So sometimes pain in the elbow can be because of the biceps, and it can originate from the shoulder joint also. Similarly, sometimes neck compressions. So when we look at the neck, we have multiple bones called the C1, C2, C3, C4, C5, C6 and C7. And between every bones, we have a soft tissue called as a disc. Disc is nothing like a shock absorber. Like how you have a shock absorber in a bike or car, God has given you shock absorbers between the bones. When these shock absorbers bulge, it's called as a disc bulge, they can compress the nerve. If it compresses the nerve on the right side, then patients might have pain all over the right side of the arm, elbow, hand, wrist, any part of your body. So we should be very careful. Elbow pain sometimes might not be only in the elbow, it can come from the shoulder or from the neck also. Coming down, elbow pains can sometimes come from the wrist also. There's something called as the radio-ulnar joint. So because you have two bones in the forearm, radius and ulnar, they are distal radio-ulnar joint and proximal radio-ulnar joint. So any condition which affects these joints can also be felt in the other part of the joint. So for example, a wrist pain can sometimes be felt on the elbow, and an elbow pain can be sometimes felt on the wrist. So overall, what I'm trying to say is that elbow pains, even though they're very common, most of the times people tend to ignore. Any pain below your hip, we are more serious about it because when we walk, the entire body weight falls. So people take it more seriously. But upper limb pains, that is your shoulder, elbow, wrist, patients try to adjust. Okay, it is painful. I knew I'm not walking on my hand. Let's give it some time. Let's adjust. In such situations, it's very bad because the more later you come, the more severe the treatment options are. Earlier stages, most of the times, just basic physiotherapy, medications, stretching exercises, strengthening exercise will be more than enough. But as time passes, different conditions require different levels of treatment. As we all know, fractures most of the times require immediate treatment because the first 5 days is a very crucial time for any fracture to be treated, because after 5 days, it unites or starts to unite in a wrong position. But tendon injuries and other things are slower problems which happen for a longer time. So patients sometimes might have a tendon injury, tendinitis and all those things happening for a very long time. We sometimes ignore it and later stage when you come, it might end up in a surgical intervention. So in conclusion, elbow pains are very common. We have to first see whether it's a soft tissue problem, bony problem or a nerve problem. Soft tissue problems, bony problems and nerve problems require different kinds of treatment. Bone problems has to be treated as early as possible. Similarly, nerve-related issues has to be diagnosed as early as possible and treated as early as possible. Soft tissue problems like the tendinitis do have a luxury of time. At the same time, prolonging it for a very, very long duration is not a healthy way of treating it. So any patient having elbow pain, always visit a doctor. Come to us, we'll properly see you, diagnose you, start the adequate treatment, and 99.9% most of the patients are completely cured of these kind of elbow pains. So thank you. We'll come again with some other interesting topic.